Hello and welcome. I am your quality auditor, Jennifer Knuff, and today we'll be reviewing our medication policies and procedures. The topics we will be going over include proper medication check-in from our families and our pharmacy, and proper medication checkout. We'll also be going over medication storage, observing medications and using the EMR, self-medication, and narcotic counting. Drug destruction, comfort kits, who gives what medicine, and medication reminders. Lastly, we will be going over adverse reactions, missed medications, and out of meds. We will get started with proper med check-in. Family medication check-in. All meds must be properly checked in and out. If a family member is bringing in meds, you will need to follow these steps. You will use the med check-in and out form. You must document what meds they are bringing, as well as how many pills. You must make sure that the resident's name is on each blister pack. You will make sure that each blister pack is labeled with the medication and dosage that is in that blister pack. Whenever possible, the label can be peeled from the bottle and placed on the blister pack. This is what the check-in and out form looks like. You can see that it has columns for the medication name, dosage, and you put the number of pills in the column that says sign in. We do not accept pill bottles, large powders, or liquids unless they are pre-dosed. The only exception to this is a tiny brown bottle of medication called nitroglycerin. If it is exposed to light, it becomes ineffective. Large powders are going to be like your Miralax or Metamucil, and the family or nurse may dose these up into Ziploc bags if they would like. If it is not correct, do not accept the meds. Once meds have been accepted, you and the family member must sign the form and turn it into the AA to be filed in the resident's file. You will then call the on-call supervisor to tell them you have received meds, and you must document in the house notes that meds were received. Pharmacy check-in is done a little bit differently, and you will not need to use a medication check-in form at this time. The pharmacy will send a delivery person to each house to bring meds. Medicines coming from the pharmacy need to be opened and compared to the manifest that the delivery driver has. You need to make sure that all meds that are listed are there and that there are the number of pills it says. If there is a different number on the paper or meds that aren't there, you need to mark it on the paper and tell the driver. You must then call the on-call supervisor to tell them you received meds. You need to report the difference to them at that time. If you sign anything with a pen, you must print your name. If a resident is going out with a family member and will be gone during med times, you will send the resident's medications with the family. You will send the strip packs with the dates and times that they will be gone, or punch out the meds from the blister packs and put them into a Ziploc bag labeled by times. You will again use the med check-in and out form listing all the meds that were sent with the family and the count for each medication. Please explain to the family when the resident gets each medication and label them. Both you and the family member will sign the form and turn it into the AA to be filed in the resident's file. Meds may not be returned to the family upon death. At that time, all meds must be destroyed. If a resident is moving out and taking their medications with them, a med check-in and out form is filled out at that time as well. The team member and family member both sign the form verifying the amount of medication that was released to them. Then the form is turned into the AA. Please keep in mind that if a resident leaves, then brings medications back with them, you can sign them back in on the same page you used to sign them out. Medication storage. Meds are stored in individual buckets, and any medications that are not taken by mouth, such as eye drops or creams, must be in their own separate bag in the bucket. Each resident must have clearly labeled meds in a bag clearly labeled with name and time that med is given. The bag should be untorn, labeled using the label maker, and should be closed at all times when in the bucket. PRN medication should be stored in a bag in the back or the bottom of the bucket, and the bucket needs to have a lid on it whenever possible. The buckets must also have labels on the front for name, room number, and each med time. You will also label the bucket with DNR, CRUSH, or other important information. Please put the company name and phone number of any services they are on, such as home health or hospice, on the side of the bucket. Overstock or surplus medications are stored in a bag for each resident and in a separate overstock bucket. Once the medication begins coming in a strip pack from Trinity, the blister pack needs to be removed from the rotation to avoid double dosing and should be placed into the destruction bucket. If the card has never been used, it can be returned to Trinity for a possible credit to the resident's account for 30 days only. Medications must be stored in locked cabinets in the Wellness Center at all times. Meds may not be kept in resident's room unless there is a doctor's order, and they are kept in a lockbox supplied by the family or hospice. If you see a bottle of Tylenol eye drops in someone's medicine cabinet, they'll need to be removed. No one should be in the Wellness Center but Mustang Creek team members. If a nurse needs something, you will need to hand it to them. Family does not belong in there. They should not have access to other people's information or medications. This is a HIPAA violation. Please do not leave medications lying out in the Wellness Center for any reason. If you are stepping away from them, they need to be locked in the cabinet. Observing medications and using the EMAR. Meds are given at various times, and each resident bucket will be labeled accordingly. You are to give meds one resident at a time. You will scan or click each med on the EMAR as you are putting it into a med cup. All meds from Trinity Apothecary can and must be scanned. You must watch each person take their medicine. You will then come back and click med given or not given on the EMAR before moving on to the next resident. We do not pre-pour or set up multiple residents' meds in cups. The EMAR should be open while giving meds, and you should compare the meds about to be given with the meds listed for that time on the EMAR to ensure that all meds are there and correct before giving. You must initial and date every blister pack or strip pack that you give a med out of. This is your proof that you gave the med. Empty cards and pouches are kept for 2 weeks and then may be destroyed by shredding the strip packs or tearing off the label from the blister pack to shred and then disposing of the rest. In the event a medication is not there, incorrect, or refused, you should notify the supervisor immediately. Watch the resident take all of their meds. Never leave meds at a bedside or on a table and walk away. If you notice there are 5 to 7 days of a medication left, please click on Needs Refill on the EMAR. By doing that, it will send it to the dashboard for the supervisor to approve and reorder. PRN medications are meds given on request or on an as-needed basis. If you give a PRN med, you need to record it in the EMAR under the PRNs tab. Make sure to click on NA in the result box for all PRNs. If the medication is a controlled substance, you will need to sign the narcotic count sheet and subtract the pill from the inventory listed. Please make sure to sign as soon as you punch the med out. Let's talk about self-medication. We do have some residents who are responsible for their own medications. Their meds must be in a lockbox in their room. There will also be a self-medication form that the supervisor will review and sign monthly to determine they are still able to be in charge of their own medications. This needs to be kept in the service checkoff book in a plastic sleeve. If there is a change and a resident is no longer going to be doing their own medications, the ED must be notified and the family must sign a new medication liability waiver. If we do a resident's medication reminders, we do them all. Narcotic counting. A narcotic count must be done at the beginning of each shift. Team members oncoming and leaving shifts will verify together that the count on each medication is correct by comparing the blister pack to the count sheet. If the count is not correct, you will notify the ED immediately. If you don't have a reason to contact the ED, that means you accept the count as it is, and it then becomes your responsibility to see that it stays correct during your shift until you release the keys to the next shift. That also makes you the responsible party if a medication disappears, because the cabinet should be locked at all times on your shift. When the count is completed, you sign the paper in the front of the narcotic book for your shift. If any narcotics are missing, an investigation must be started, so please count carefully. Protect yourself. Anytime you accept or release the meds from someone else, please count. All team members are responsible for starting the narcotic count sheet if they receive medications. If there is more than one blister pack of a med, for example, if the pharmacy sends 90 pills, they will usually send 3 cards of 30. You will need to make a separate count sheet for each blister pack when the meds come in from the pharmacy. Number the cards in the sheet so you know which card belongs to which sheet if there are multiples. Drug destruction. Meds for destruction need to be logged on a Trinity drug destruction form and then turned into the executive director. All narcotics for destruction are logged on a separate destruction form and immediately taken to the executive director to be locked up. All narcotics must be counted if they are in your house, even if we are no longer using them, so please get them turned into your ED as soon as possible. When logging medications, please do not write in the first column that says number, and do not write across the bottom. Those are for office use only. If meds are refused or not given or are loose, they need to be put into a Ziploc bag and labeled with the resident name, medication name, dosage, and the RX number if you can find it. Please do not tape up med cups and put them into the destruction bucket. We need all the listed info to be able to do drug destruction with the pharmacist. Comfort kits. Comfort kits are the boxed medications that hospice sends for their residents. They send them in a sealed box. If you receive any of these, you will need to make a single count sheet saying 1 sealed box. Each time you count, you will look at that box to ensure the seal has not been broken. Once the seal has been broken for any reason, each narcotic inside the box will need to begin being counted. There should already be narcotic sheets in the box from the pharmacy, and if there isn't, please make one. Who gives up medicine? The night shift gives the 6 a.m. medications. The 6 a.m. relief will give the 7 a.m. medications. And then the 7 a.m. person should take over medications after that. It is done that way so once you get there, do your narcotic count, read the house notes, check on your residents, and start your day, the medications are not late. It is important that 7 a.m. medications are given as close to 7 a.m. as possible. They are meds that must be given on an empty stomach and before other medications. If they are not out of the room, please take it down to them and ask them to take it. They're free to go back to sleep afterwards if they would like. Medication reminders. Mustang Creek team members do not administer medications. We do medication reminders with a hand-over-hand method. We can put the medications into a cup and then we hand the cup to the resident to take. If they are unable to take them by themselves, we may put our hand over theirs and help guide it to their mouth. If it is a crush medication, you will mix it with a bite of food, put it onto a spoon, and then we will put the spoon in their hand to take. If they can't take it, we can help guide it to their mouth. If they still can't or won't take it, we want to try again in a little while. If they still won't take it, we will mark it as a refusal and put it in the house notes so the other team members are aware. Please use gloves to assist with eye drops, ear drops, nose spray, and any creams. If a resident has an order to crush meds, please note that each resident should have their own pill crusher. If you need to take any blood pressures or vital signs for a medication, make sure that you do it first. If it says to hold if the blood pressure is too low and you've already given the medication, it will be too late to hold it. Adverse reactions. What is an adverse reaction? When handling medication, it is an unexpected or dangerous reaction to a drug or an unwanted effect caused by the ingestion of a drug. The onset of an adverse reaction may be sudden or it may develop over time. Common adverse reactions can include, but are not limited to, fatigue, headache, confusion, drowsiness, dizziness, loss of appetite, nausea, rash, shaking, constipation, allergic reaction, anxiety, diarrhea, difficulty breathing, trouble sleeping, and excessive sweating. If you notice any of these symptoms in the resident, or even just notice that they are acting differently or out of the norm, you will need to contact someone immediately. Well, who should I contact, you may ask? If they have a home health or hospice nurse, you need to call them and tell them of your concerns. You also need to contact the ED and the on-call to notify them of what you noticed. We will now be documenting adverse reactions into Eldermark. You will go to the Resident Chart button in Eldermark and find the resident's name. Once opened, you will look for the Notes tab and select it. You will click the green Add Plus button to begin a new note. Once opened, you will type in what you are noticing into the box. Please be very detailed. It is also helpful to document who you notified. An example note might read, I noticed that after I gave Philip his 4 p.m. medication, he's becoming very sleepy rather quickly. I reported it to his home health nurse, Laura, and she will come in and check him. I also notified the ED and the on-call supervisor, Wendy. When you are done, make sure to hit the Save button at the bottom. Missed medications. It is important that the missed meds are cleared from the dashboard twice during your shift. If there are any missed medications, it means that the EMR is not being used to pass medications. This needs to be monitored so that you can properly teach your team. Please make sure that your team knows that they must use the EMR to pass meds because the orders can change frequently and without notice. Out of medications. Medications should be reordered when there are 5 to 7 days remaining. Supervisors must go through the med buckets 2 to 3 times weekly to make sure that all shifts have the medications that they need. Anytime we are out of a medication, we have to know why. You should ask your team to call you if they run out of medication because you will know if there is more of it somewhere in your med cabinets. If there is no more, you can tell them what to write in the notes section so that you do not have to go back and add an appropriate note the next day. A proper note includes why we were out of meds and what action was taken that day. Out of meds cannot always be avoided, but you can always take an action to help resolve it. You can call Trinity or hospice or the family or whoever provides that medication. Include in your note who you spoke with and what they said. Do not include in your note what you plan to do, that you plan to call the pharmacy or that you plan to call the family. We need facts. Each day at stand-up, you will be given a list of the meds in your house that were marked out of meds. You will need to take that list and add any notes that are empty or change any notes that aren't appropriate. When this is completed, you need to check it off and turn it into your AA before your shift ends. Thank you so much for listening. We will now be going over a few more things and then we will have a short quiz on adverse reactions.